component of lateral decubitus, which means the patient's placed on their side. The reason being is there's a number of these labrums, which we can see, and you've seen them in the research, that basically these anterior labral tears, the tears in the front, are actually tearing all the way to the back. And as a result, if you're doing this in the lateral position, it's much easier to see these type of labral tears. Now, again, this is a preference, but it's something that I like to give for tips for these newer surgeons, which people ask me about, is how do you address these other lesions? And if you find the posterior labrum tear, or you're doing a posterior labral tear and you find an anterior labral tear, which I frequently see, you can easily audible and go between sides. The other reason I like this, and you'll see in some of my videos, is there's this special cannula called the Gemini cannula. The reason it's so important is because the back of the capsule is very flexible. And this cannula allows you to open up and has fingers on it, so you can actually use it as a retractor. It makes it much easier for this posterior area to fix it. So when these posterior labral tears, access can be difficult sometimes, and having these extremely small fiber tacks, in addition to having this sort of Gemini cannula that you can pull off, which you'll see in some of our videos on our website, is really sort of the game changer, and it becomes even better when you start thinking about doing things like remplissage.